The demand for qualified health science professionals is ever growing, but not a new concern, and our area is not immune to this issue. In Go Virginia Region 2, which includes the areas of Roanoke, New River Valley, Alleghany, and Greater Lynchburg, a committed group of educators, employers, workforce and economic development professionals formed an effective employer-led coalition to address workforce needs. Following a collective impact model to align and integrate actions of over 48 stakeholder groups, Carilion Clinic serves as the anchor organization providing staff and overseeing efforts to improve health sciences education in our region. Get to know us, the Blue Ridge Partnership for Health Science Careers.
Roanoke is in an economic shift from a train town to a brain town. And what that means is that the life sciences and health industry cluster is growing in this region and transforming our economy. Healthcare providers and bioscience companies recognize that we would not have enough talented workforce to build the enterprise that was unfolding around us. So as we began our work, we realized what a large scope this was going to be. And so we created interdisciplinary teams. We put educators at the table with employers. We put workforce organizations and economic developers at the table with employers. And some of the conversations that came about were so creative and so imaginative that we realized one of the happy byproducts of this work was the building of trust and the breaking down of silos. And so where we might have seen a barrier, all of a sudden we had a creative solution to some of the things that we could bring to this effort.
Recognizing the need to work synergistically to foster change, we created a new model for health sciences education and workforce development.
As the work started to unfold, we realized that there were some things that we could address on a regional level, but that we could not address across the board, such as regulatory issues or accreditation issues, and so we needed to bring statewide or federal or regulatory stakeholders into the mix. And so we went from a coalition of the willing, is what I like to say, to a more formalized structure. And we have become a 501c4 organization, which allows us to advocate for some of these changes and some of these resources that need to be involved and brought into the effort.
We believe very much Virginia should be the talent state, and you've got to retain talent. And the first place you retain talent is within a region. Because I think one of the keys is that each region has strengths as far as what their industry is. This is just a healthcare hub right now of life sciences and healthcare. And so I think what this will mean is you'll have so many high school students, students who go to college here, students from out of state that will come and stay here because of everything's in place.
As we know, healthcare careers have always been very viable and robust, but there's also always been a shortage. In my career of 40 years, we have always had a nursing shortage. And the first meeting was about 3 years ago, and we invited high school, we invited a community college, some of the four-year schools. We've expanded since then. And then really the local workforce boards, and said, why don't we get together, talk about this, and see if there's really something here. And all the partners said yes.
Our education partners help bridge the gap between education and employment by increasing access to industry training, certifications, and degrees for students and instructors, bringing students and employers together, giving employers access to prospective future employees, and more.
So one of the best parts about the partnership is academic institutions have come together, 2-year schools, 4-year schools, public and private, to start mapping out what is a common pathway for students starting in high school. So not only does it make it where a student can go to the most convenient, the closest, the university that resonates with them, it also provides them a seamless transfer pathway. So they get to their degree the fastest with spending the least money, by taking courses that are useful wherever they go.
We have a history of being very innovative and collaborative with our K through 12 partners, our employers, and economic development partners in the community. So this was a terrific opportunity to support our regional educational institutions in providing a common curriculum in health sciences and providing more options for our region and opportunities to go into healthcare pathways or health science pathways. There's also an opportunity for our students in the region to develop credit in high school, known as dual enrolled credit, a certificate, an associate degree, leading to opportunities for employment within our region.
Health science jobs are not just about health. This industry is a large source of local employment. Our model is fostering a culture of innovation and economic vitality that makes our region attractive to companies of all sizes seeking a strong talent pool and access to quality health care.
So the real magic behind the Blue Ridge Partnership is the trust and the collective impact and coordinated efforts that have really emerged from these efforts. So bringing people to the table that otherwise wouldn't have the opportunity to work towards these solutions has really been magic to watch. So driving in each of the task forces, driving the deliverables and having discussions on what it would take to solve for any barriers that are identified, and having those decision makers at the table to be able to actually, problem solve together has really shown remarkable, deliverables out of this effort.
We operate through community leaders who value and know the importance of health and life sciences. The current need for qualified health workforce, along with the projected growth of the health and life sciences industry, demands everyone move quickly.
The job opportunities that young people don't need to go anywhere else. There's an exciting and dynamic and bright future right here in this region.
Replication is not necessarily easy, but I think it's essential. And what else I think we can learn from this effort is that it doesn't have to be just healthcare. This idea of a highway concept is a framework that can be used in other fields as well. And what it allows is if the state says, hey, we're going to think about your life as a journey, and we can pave a few roads to help you through that journey, let's do it.
Everybody that's involved with the partnership is dedicated to creating meaningful career pathways for students, for families. It's about making lives better, not just the people that are being seen or treated as patients, but the lives of the families who are involved in delivering that care, creating the research opportunities, bringing new discoveries to the bedside. It's about making life better for everyone, and the work of the partnership is doing that.
The Blue Ridge Partnership for Health Science Careers is a one-stop shop for information about navigating a career in health sciences. To learn more or get involved, visit virginiahealthcareers.org.